As Dan said, I am Mary Devaney, and I'm with the Great Plains Telehealth Resource and Assistance Center. We shorten that way down to call ourselves GP Track. Makes it a whole lot easier, flows off the tongue a lot better. Excuse me. We are one of 14 federally designated telehealth resource centers across the nation. There are 12 regional centers, and those 12 regional centers cover all 50 states. GP Track covers North Dakota, South Dakota, Nebraska, Minnesota, Iowa, and Wisconsin. There are also 2 national TRCs. They are focused on specific topics. One is specific to telehealth equipment, and one is specific to policy. The TRCs have been in existence since about 2007. I'm going to get that off there because it's cycling for you. There we go. We've been around since 2007, starting out with just, I think it was 4 centers across the nation. We've now grown to the number that we are. The purpose for the telehealth resource centers, I should tell you first, we're funded through the Office for the Advancement of Telehealth, which is located within HRSA, Health Resources Services Administration. And also underneath that is the Office for Rural Health Policy. The purpose for the telehealth resource centers is to really simply help you. We don't sell services. We don't sell equipment. We are, I like to say, we're agnostic. We don't lean one way or the other from the perspective of which network you should be connected to or which connections you should be having, but we are an information and help center for you. If you're looking at figuring out what can we do with telehealth, what should we do, what's out there, who's doing what in our region, across the nation, that's really what we're here to help you with. We have a great relationship with the other telehealth resource centers. So if you call and ask us a question about, golly, tell me about this. If I don't have that information, I know who to go to find it. We have a great, like I said, a great relationship with the other resource centers. We regularly communicate. We send questions out to each other on a regular basis saying, has anybody else heard about this? Is anybody else doing this? One of the things that I think is especially helpful from the Telehealth Resource Center perspective is that if you guys are thinking about doing something maybe a little bit unique or simply just wanting to talk to somebody who is of similar size to you and looking at developing telehealth services, we can connect you with somebody similar. The Telehealth Resource Centers, all of us, have a great deal of information online. As you see, I pulled up what's called our Resource Center. Here you'll find a whole lot of information in all of the tabs, but I just want to bring this one up in particular because it has a number of things there that are extremely helpful. Actually, I'll pull this one up here real quick. So this is here we go. Let's do this one because that will show you a more current picture of who we are here. One of the things that the Telehealth Resource Centers provide, and I think that this would be helpful for most of you here, is we collaborate and provide a series of webinars on a monthly basis. They are available, I think it's the 3rd Thursdays of the month, and they have a variety of topics related to telehealth, all things telehealth. So the National Webinar Series really provides an opportunity to kind of hear what's going on around us and to give you some good ideas as to what's kind of out there and what might be something to look at for your own organization. This is just some of the topics that we've had this year. We can go back and kind of glance through some of the things that have been provided last year. So you see there's kind of a variety of various topics. Each of the resource centers provides a topic kind of each month. So, or I should say a different TRC provides a topic each month. So go in here. The webinars are recorded and available. So if you find a topic that you're really interested in and you're bummed you didn't get to actually sit in on it, it's here for your viewing at a later date. Some of the other things here, we've got just, like I say, a variety of resources that you can tap at any time. The telehealth the GP Track Toolkit, I think is of special interest. There's a couple things here that I think you'll find especially helpful. This one is called the Telehealth Startup and Resource Guide. It was actually specifically developed for Iowa in collaboration with Telegen, who is actually HealthPOINT's partner, or not partner, I guess they're a similar organization over in Iowa. And this was really designed in collaboration with them, and it specifically walks you through some of the things that you need to know in regards to developing your telehealth program. There's also one here that I think is that you may be interested in as well, and this talks about developing telehealth from the perspective of the clinical services. This particular document is really designed to be an issue awareness document, raises up the things that you need to be thinking about as you're looking at implementing clinical services within your organization. It doesn't give you the answers, but it gives you the issues that you need to organize through, walk through, discuss within your own organization, and resolve specific to how your organization runs. So it highlights some of the things you need to be aware of as you're thinking through that. So it talks about, like I say, there's just a number of tools here. Go through our website. There's a great deal of information there. Annually we have, and all the TRCs actually do this. Ours, we have a annual conference. Ours was just held in early April. I know some of you were there. As part of that. I know Scott's team with Horizon Health and John's team there, they had a presentation there as well. And it's really an opportunity to kind of get a sense of finding out who else is out there, especially in our area, and build some of those connections, build some of those friendships, and identify maybe some potential partners. The other thing is just to give us a call. If nothing else, get on our listserv, get on our mailings. We send out regular information in regards to telehealth. We have a blog that we kind of provide information of interest. I think one of the things that's been most interesting in the last really couple years is we've seen a significant increase in the interest around telehealth. We've seen organizations who haven't been involved in telehealth over the last several years raising their interest, trying to figure out what might be their first step into this area. We've also seen quite a bit of legislation kind of percolating around. This year, probably the most interesting for South Dakota is that we became part of what's now up to 9 states that have come on board with what's called the Interstate Physician Licensure Compact. And what that will do for us, by the states, they needed to have a minimum of 7 states to kind of get the compact moving. But what the compact will be ultimately designed to do is to streamline that cross-state licensure process for physicians. So right now, it's a fairly extensive process that each physician must go through in order to be able to provide services, whether it's in person or via telehealth, in multiple states. What this process will ultimately do is streamline that so that it's a faster process, it's a more efficient process, it's a more cost-effective process. And ultimately, I think that will make things a lot easier, not only for telemedicine, but just certainly for healthcare services in general. So that's been one thing that we've seen a lot of interest in. The other thing that we're seeing, even in our region, but certainly nationally, is the interest in what's called parity for telehealth for reimbursement. So the idea that you can be reimbursed equally for services that are provided in person, and then if you're providing that same service via telehealth, you would have an equal reimbursement for that. Minnesota just passed that. North Dakota's passed kind of a pilot project in that, and there are a number of other states around the nation that have also passed that. So we're seeing a lot of interest in that area, and honestly, we're seeing there's also a lot of interest in what I would call maybe the non-traditional telehealth services. So the traditional telehealth that's kind of been around for a couple decades now, the specialty services, maybe the ICU, certainly the emergency room services, those are all, I guess, have kind of grown from the original programs that have been in place for several years. We're now seeing interest from insurance companies, from workplace entities, looking at how might we also implement telehealth. So we're seeing a lot of interest in what is called the direct-to-consumer services. Those that instead of a patient coming into an official healthcare facility, they're accessing care either from their home, maybe from their workplace, maybe from their school. And so these are all some of the things that are kind of really looking at growing in the area of telehealth. And we have the opportunity to really reach out to organizations, as I said, around the world, but certainly around the country, to maybe link you with some folks if you're interested in learning more. What I have done, and I'm keeping mine fairly brief here, but I will leave some flyers. I didn't bring enough for everybody, so if you're within the same organization, grab a flyer. I will leave my business cards there. We're here to help you, and I reiterate that. We're here to help you. We're not here for our agenda, we're here for your agenda. So if there is anything that we can help you around the area of telehealth, please give us a call. That's what we're funded for. If we're not doing that, we're not doing our job. So I will leave my business cards. Feel free to call me. Like I said, I'm in Minot for a day or two here now, but then I'll be back and can actually visit with you a little more in depth. And I'm there. We're here to help you.